This week on Inside Olympia, how is Washington's prison system navigating the latest rise in COVID cases and a TB outbreak? And how is it managing through ongoing staffing shortages? On the program, for the full hour to discuss these and other issues, is the Secretary of Corrections, 1 year into the job, Cheryl Strange.
From the TVW studio, it's Inside Olympia with host Austin Jenkins.
And welcome to Inside Olympia. Washington's prison population has dramatically shrunk in recent years. The system has also lost employees due to the governor's vaccine mandate and other factors, creating a staffing shortage. Now, as COVID continues to stress the staff and the inmate population, the Department of Corrections is hearing frustration from both. At the same time, the agency faces pressure to end the practice of solitary confinement and embrace a health care model that puts the health and welfare of inmates front and center, with the goal of releasing people who, in the words of the state's former corrections ombuds, are more physically, emotionally, and mentally well than when they entered prison. Joining me now and for the full hour this week to discuss the state of Washington's correctional system is Secretary of Corrections, Cheryl Strange. Welcome back to the program. Good to see you. And it has been a year since you've been in this job, almost to the day. So you came over from DSHS, a very different agency, but also in some respects there's crossover, obviously, in terms of the mission and serving people in the state. But what are some impressions a year in?
Wow, Austin, thank you for having me. You know, there's a lot of movement going on in corrections. The things you have just mentioned have been top of mind for me, certainly for Governor Inslee as I step into this role. I think the staff of corrections, the work of corrections is a bit misunderstood by the general public. There are people working in corrections who are very mission driven. They are there to support incarcerated individuals in their journey. It is an agency that is constantly under the gun, under fire. It's very misunderstood. You know, prisons are one aspect of the whole Department of Corrections, but it is the one that's most hidden, I think, to the public. You know, when you build a prison, you go to the end of the road and then you go a little further and you build a prison. So they tend to be in rural areas. There's not a lot of transparency. I mean, people can't just walk in. Hardworking people, I'm struck by, you know, I was there 10 years ago, 12 years ago as the Deputy Secretary for Secretary Vail under the Gregoire administration. And I think it's lost some of its nobility, if you will. It was a very noble profession. It was a very professional organization, and staff took pride. I think that it has become more challenging to do that, certainly in the face of COVID and crime. It's a challenging thing to, on one hand, you have individuals who the culture external to the department is punishment and crime, and on the other side you have retribution and habilitation, and I think that creates a tension.
Well, certainly the overlay here too is of course COVID, and yes. I would imagine that everything that's happened in the community and society generally is sort of amplified and intensified. Again, if we're talking about prisons, within the four walls of a prison, there's a little less elbow room to mitigate, although with population down, you do have a little bit more room to work with. But I get the sense that maybe a tipping point has happened or was reached within the last few months where some of your incarcerated individuals and some of your staff were sort of saying, enough is enough. Yeah. I know the staff, some of the unionized staff came to you at headquarters with some demands. We've seen letters from advocates saying that this is really taking a toll. I get emails from people complaining about the SAC meals they're getting during lockdown. So I want to talk about that, but first just point in time update, you have 4 of 12 prisons on COVID
who are in outbreak status.
Okay.
Correct.
So
out of 12.
Out of 12. And then there'll be some units in other prisons that are also in outbreak status, but not the entire facility.
Right.
What is, take us inside for a moment. If a facility is in outbreak status, what does that mean in terms of the day-to-day operations?
It varies based on the prison itself, Austin. Prisons were not built to deal with infectious disease. They were not built for programming. They really weren't even built for visitation. And so you overlay COVID over that. An outbreak status is a definition that we use. We're on day, I think, 840 something of the COVID response. So give that some perspective. Protocols are changing regularly. We're working closely with the Department of Health, as every agency is. And so the protocols change a little bit based on the type of prison it is, whether it's, cell front or whether like Monroe, which is a very old prison, contrasts Coyote Ridge in Eastern Washington. That's one of a more modern prison.
With more of a pod-like system,
right.
Or a layout?
Yes, so they look very different. Each prison looks a little different, and then of course you have camps. But an outbreak, depending, people are in, there's a lot of testing going on. There's a lot of screening for staff.
Right.
And so there might be some units that are not allowed visitors. Although we do try really hard, we've done everything we can to retrofit. Visiting is so important. Programming.
And it was shut down for a long time.
It was shut down for a very long time, and it'd be open it up, and then close it back down again, with the different variants. The original, then Delta, then Omicron. Omicron was unique in and of itself.
Just to be clear, are the incarcerated individuals, are they locked down in their cells?
If they are in isolation. What we've done, though, to kind of pivot and adjust for that, is we created cohorts of groups of people who might be in isolation so that they can move together. So they could very well be in a cohort that gets out to the yard, outside air, exercise is very important. We try to keep movement going. So we get people out of their cells.
You were mentioning programming.
Yes.
How is that affected? Is that also sort of stop, start, depending on what's happening?
Yes, what we've always tried to do from the very beginning. Keep in mind that a lot of our programming is done by volunteers or contractors coming in, and of course they were not allowed in. We got very creative. Staff got very creative with that. They started going to the cell fronts, in the early stages of COVID, going to the cell front, talking, doing as much programming as they could, but it was on an individual basis. So it was really challenging. And then as soon as we could, let visitors in and contractors, things started opening up a bit. But it is touch and go still. It is 2 steps forward, 1 step backwards in the Department of Corrections with COVID.
I want to read to you just from a February story from the Everett Herald. The opening was, in Washington state prisons, COVID is exacting a growing human toll and deepening a sense of anxiety regardless of what side of the bars you're on. Those in custody are frustrated and angry. They wonder each day if they will have a hot meal, a chance to shower, a few minutes outdoors, or even heat in the cells. They worry a positive COVID test will land them in isolation for days, and fear a botched prisoner move will bring the virus into their wing. Mm-hmm. Corrections officers are exhausted and angry. Fatigue from 16-hour shifts is setting in, especially days spent in medical isolation units, where for their health and safety they must wear rubber gloves, a full-length gown, a respirator, and a face shield the entire time. Mm-hmm. That's a portrait of an environment from a couple of months ago in the prisons. How do you respond to that?
That article, I think, I went to that prison and I,
And this is specifically up at Monroe.
Yeah, and I toured and I talked with staff.
Yeah.
This was in the height of Omicron, and Omicron hit fast and hard, and it hit everywhere all at the same time. It did leave us scrambling. Mm-hmm. Staff were exhausted. I mean, you could see it in the numbers. on average 28 hours of overtime, mandatory overtime per month for every corrections officer, and that's on average. So people enjoy overtime, and
Up
many
to a
staff
point, perhaps.
perhaps, but ongoing and continued. I toured that facility. I went to all the units. I donned the required PPE necessary. I spent a lot of time. I spent the day talking with incarcerated. I spent the day talking with staff to check in. The staff I spoke to, I bet I spoke to 50, 60 staff, and there were a handful of them that told me that they are exhausted, and when was this going to end? For the most part, staff were showing up. They were saying they were tired and that they were committed to being there. It's been tough. Going into COVID-infested facilities, so to speak, where that takes a lot of bravery and strict adherence to protocols. And it's settling. We've been able to give staff breaks. We've encouraged vacations. We're prepared for maybe a fall surge. We don't know.
Yeah. Let's talk about staffing. The numbers I have, correct me if they're not don't align with where you are, but that you're down about 600 full-time employees in the agency. And this would be sort of looking pre and post vaccine mandate. I know not all of the reduction is due to that.
Correct.
And you're hiring at
We are.
the moment. But your population is also down, and this always gets a little tricky because just because the population is down doesn't necessarily, if I'm remembering correctly, mean you need fewer staff just because of the nature of the layout of these facilities. But you're also in some cases mothballing or shutting down some units, at least if you don't need them. But what is your current staffing? Are you in a crisis?
I don't know that we're in a crisis. We're in a oh dear moment for sure.
Okay.
I think of crisis, Austin, as things that would create significantly unsafe conditions, where staff's lives are in danger or incarcerated individuals are in grave danger. We are not there. We lost, I had 8,800 staff when I came to the department a year ago. You have your normal attrition with retirements, and there is a retirement cohort in state government. All the agencies are concerned with that. Yeah. But my numbers suggest that I know are around 400 due to the vaccine mandate. It's not uncommon to have a few vacancies, and that's really the way that the agency can meet some savings targets and things like that, but certainly not unsafe. We need staff, and we need staff for today, we need staff for tomorrow. It's not clear to me what the future of those prison bed populations are. Right before we knew this last budget cycle, the state was going through furloughs. We did furloughs, which is when staff take time off and unpaid, because we weren't clear about the budget and the federal money. That picture has since changed, but we did not know at the time, and we were set to close 4,000 prison beds. When I got to DOC, right before COVID, we had 18,000 incarcerated individuals, and about the same on community supervision. Different clientele, but today we're somewhere between 12,000, 13,000 incarcerated. So trying to close those prison beds, I tried. I'd close a unit or close a bed, and then Omicron would hit, Delta hit, and we had to, do the social distancing again. So a lot of flexibility. There are 30,000 individuals waiting to be sentenced by the court.
30,000.
30,000. 10,000 of those charges are violent felonies.
Wow.
So, while we continue to focus on closing beds that we're not using, those beds take staff when they open. And so I think being flexible and nimble is what I'm trying to do inside the department to the best of my abilities, given legislative requirements and things like that. But I'm not sure what the future holds with the number.
And you've noted that the numbers are already coming back up again. You may have hit your low.
Yeah, just this, for a couple weeks now, we've seen more people coming into prison than we've seen leaving prison, being discharged. So, we're trying to predict that a little bit. I don't have a crystal ball. I'm not really sure. I'm watching closely.
I know the union in March came to you, as I mentioned before, and it seems as if some of the frontline staff do feel that their lives are potentially endangered. One of the officers told you, "I feel like you guys don't care. We can't keep doing this or somebody is going to get killed." Somebody described a kind of chaotic environment. Our unit is out of control. Drugs are everywhere, and there's a lack of training for newer staff who have no idea how to perform their jobs. We don't have the staff to keep each other safe. This was the union members who came to you at headquarters in March. Mm-hmm. They seem to be telling a different on-the-ground story. Now, that was a couple of months ago, but what's your response to that? I mean, the last thing was, these changes can't wait or someone is going to die. Pretty strong comments.
Yeah, the staff inside the prisons are represented by Teamsters, Local 117, and they, as members, and my staff are my employees. I care about the same things that the labor organization cares about. Thank God we haven't seen any of those life-threatening situations occur. And they have occurred in the past. The death of Jamie Bendel.
Yep.
That is very much in every correctional officer's mind, whether they've been working for us for 30 years or whether they've been working for us for a year. Yeah. We did take a pause in our in-person training, the 6-week Correctional Workers Academy for people working in prison. Mm-hmm. And we tried to do that virtually. It's not the same thing. Mm-hmm. We took very seriously low numbers of staff.
Yeah.
Minimal staffing levels. We didn't get below minimum staffing levels. Barely, but we did not. Who pays a price for that too are incarcerated individuals. There's programming, movement stops, that kind of thing. We have to be very careful. We have not put anybody out on the front lines of working in a prison who isn't trained and qualified to do so. We had a lot of support from other divisions, community corrections, our health services unit. So, those concerns are very real, but they are concerns we all have. And I think we're working well with the labor organizations across the Teamsters, the Federation, the Coalition. Workforce adequacy is top of mind for myself and my colleagues in the human services. Our 24/7 facilities across DSHS, DCYF, all that.
How is the hiring going? And has there been any talk with the governor about rehiring people who left because they wouldn't get vaccinated?
Those conversations are occurring. I have not heard, the governor has not given any signal that he is willing to put the safety of staff at risk by allowing unvaccinated individuals into facilities. And I have not heard of him looking to change that.
In terms of your own hiring, then, just as you put, I mean, there's literally ads running right now.
There are ads running. I don't think we're alone in that. There's a lot of competition between agencies, you know. I think we're looking at things like, I think my HR department and leadership is working with the leadership of the Department of Children, Youth and Families, Department of Social and Health Services, Veterans Administration, to work together to try to come up with some ideas for the governor for a potential, you know, relook at how we're going to address the workforce. You know, health services, you know, that has been on the governor's mind and my mind as a cabinet member for many years. And you know, tomorrow's workforce, where are they coming from? And there's, what is it, the Great Resignation? It's happening, and we are doing well. We're targeting. We're trying some different techniques to engage in a good state job with a state pension, and I think we have good jobs.
Yeah.
And a safe, you know, safe environment. There are some things we're doing for professional fulfillment. The Amend project, which is bringing professionalism and rewarding job to prisons with our staff, and it's a very exciting opportunity and promise of Amend to bring that from the Norway prison system and the things they have learned about making good citizens.
And this was the idea that rather than the custody staff sort of viewing themselves as, we're coming in here, keep the place safe, keep everybody in line, it's developing some relationships.
It's a little more therapeutic in nature.
Which has almost been the opposite of what they've been trained to do, because as I understand it, there's generally the thought has been don't develop relationships because that can create a vulnerability. You need to
draw a line. You see that in all kinds of I was in the, you know, the behavioral health world when it was very formal and you didn't communicate outside of this therapeutic requirement. And what we see is a softening of that, a more human-centered approach where the client is in the middle. The Norway premise, or the Amend premise, I should say, is really you go to court to be punished and you go to prison to become better neighbors. And we're very excited about the staff who have been engaged in that training, and as we incrementally bring it in, you can't change culture overnight. Staff are responding very favorably to it. They really are connecting with it, and I'm very excited. We are getting ready to go. I'm sending a group of staff over to Norway. Most of the training occurs here in our own prisons here in Washington, but we do go over. I'm sending, I think, 9 folks over next week to get a feel of what it really feels like. There's so much you can learn by seeing.
So that's part of this pivot or an effort to try to change the way we approach corrections. And your thinking is that in terms of also thinking about the workforce of the future, that if the work inside the prisons and maybe outside the prisons, because you do have community corrections shifts, you might be able to attract a different cohort of people into this profession?
Yeah, and I think what we're aiming for too, Austin, is some people come in to corrections to help with reform, to be there in support and support incarcerated individuals who are people living in poverty. They are our Black and brown men, you know, that to come in to help. It gets lost though. The time, you know, our staff go to prison too. Mm-hmm. They're not the most colorful places, although we do some very amazing things with the Sustainable Prisons Project. I mean, there's some great stuff going on there.
But it's a unique work environment.
It is a very unique work environment, to say the least, and we need people who who want to be there and are safe to be there and engaged.
If you have a problem child among your 12 prisons, it would seem to be, at the moment, Stafford Creek.
Yes.
First off, before I ask you about the issues there, let's talk about the TB outbreak, which is on top of COVID.
It is.
So let's start with that. I think that's the largest tuberculosis outbreak we've seen in this state in more than 20 years, I believe. Centered, as I understand it, at Stafford Creek, which is out in the Aberdeen area.
Correct.
What's the status of that outbreak at this point?
So, backing up for a minute,
Yeah.
Prisons, as I think I said, with COVID, they were not built for the state-of-the-art HVAC equipment. They were not built to address and mitigate around infectious disease. So whether that's COVID or TB, TB is on the rise all across the country in prisons. We today have 17 active cases of tuberculosis. We have tested 1,500 individuals, and it's been primarily at one facility, although you have to keep in mind that people move. Incarcerated individuals move from reception to prison, and depending on their classification, sort of what level of prison bed they need to be in. So there is movement. So we do a lot of contact tracing, similar to what we do for COVID-19. Yeah. We're working with the CDC. It's not a one test, it's not a nasal swab and boom, we know in 5 minutes whether you have COVID or not. It takes a long time. We actually have to grow culture in a petri dish. Wow. And so there's sort of 4 key steps to getting diagnosed with TB. We had a scare in that there was a national shortage of medication to treat tuberculosis. We set up an incident command. We invited the Department of Health to come into that incident command and be with us. Together we were able to secure some medications. So it's curable. TB is curable, it's treatable, it's not a death sentence. And we're still in the middle of that. And we've got the Center for Disease Control has been out twice. I spoke with them when they were here a few months ago. I haven't spoken with them since they've been here. They've been primarily at Stafford. So the prisons are just circulation, ventilation. It's really critical to do a good job of screening, and it will be interesting to see what the ultimate finding is as to how this happened. Yeah. I suspect this is all part of healthcare reform at the department. This is part of COVID response and consuming all the air in the room. It's been challenging.
Okay, let's take a quick break. We'll pick this up when we come back. When we return, we continue our interview with the Secretary of Corrections, Cheryl Strange. Back right after this.
The future of space exploration.
I think there's a lot of opportunity that we don't even know exists.
The Artemis missions should have humans on the moon by 2026, and Mars is not far after that.
And welcome back to Inside Olympia. What should a 21st century prison system look like? And what efforts are underway in Washington to reduce recidivism and create a more therapeutic prison environment? Joining me once again is Secretary of Corrections, Cheryl Strange. Before we get to that, I do want to ask you a couple more questions about Stafford Creek. Regarding the TB outbreak, advocates are concerned. They're saying there's not infection prevention staff inside Stafford Creek to monitor and control this outbreak, that there's no fit testing for employees or inmates to protect them from the spread. They say the TB isolation room is broken and that there's no ETA in fixing it. So the question is, where are the active TB cases residing right now? And generally they feel like there's not accurate numbers coming out of this situation. Have you heard these concerns? Do you have a response?
I've heard of some of those, yeah. Austin. What I can tell you is, we have 17 active cases, and what that means is part of the treatment of that is being in a negative pressure room, and we have 14 of those. And so 14 formal negative pressure rooms. Now, the one at Stafford Creek, I looked into that concern when they said the room was broken. And it is certified. I spoke with our risk manager, Kathy Gastrike, who oversees that and is the liaison with Labor and Industries. And that negative pressure room is certified for use. It is not broken.
Is there a reason? Is it not being used? Or is it?
They are being used. We're using 14 out of the 14 that we have, and then we had to create some external. We had to convert one of our extended visitation units to accommodate the remaining 3 patients. So they're currently under treatment. In terms of fit testing, or let's talk about infectious disease staff being on site. We have a cadre of occupational nurse and nurses within the infectious disease program. They aren't located at each site. They are centrally located, and they are spending time at Stafford. So they are part of the incident command. They are there. They are regularly available to Stafford with this outbreak. Fit testing is something that we require to be done. Mm-hmm. It requires a medical clearance. And I think there was some issue around, was a medical clearance absolutely required, because we wanted to get a lot of people fit tested.
This is for a mask?
It is for an N95 mask, and it requires, it's a little tighter than what we know as our N95, but a respirator mask. Yeah. You must be clean shaven. And you have to be fit for it. And, I think our staff are fit testing. I think, as always, there are isolated incidents where maybe something didn't go as according to plan, and staff hear about these things and they get very concerned about it. And I understand that. It is scary to walk inside any environment where you think you could catch something, and is the department taking care of you?
I mentioned Stafford Creek maybe being a problem child because there was a fairly large fine having to do with not, this was earlier on, abiding by COVID protocols. And there is, so that facility's gotten a lot of scrutiny, and now the TB. What is your sense of, and have you made any leadership changes there, and how this facility is being, in particular, is being operated?
Mm-hmm. I'm concerned about all my prisons, absolutely. And Stafford seems to be having a lot of struggles right now. There's some great things happening at Stafford Creek. I have not made a leadership change at Stafford Creek, and the reason is it is challenging with COVID to really determine what the root cause is. What is it? Leadership. The superintendent out there, his team, we've been out there. I've had my staff out there. We've got a lot of eyes on the facility. That superintendent is highly engaged in COVID protocols, walking around. His leadership team is walking around. It's difficult to recruit for staff in Aberdeen, medical staff in particular. Okay. So it has its problems, but I don't think removing the superintendent is the answer.
Just one last question about that facility. One of the other complaints is that this is more related to COVID protocols, but I guess that because of and maybe also TB, but because of the quarantine, this has affected the kitchen operations, and so they're getting bagged lunches. But some folks are saying that they're getting frozen food and that there's no microwave to warm it up. Have you heard anything about that?
I have not heard that there isn't a particular microwave to warm it. We have microwaves all over our facilities. Is one broken? It's possible. And I don't want to discount the staff reporting those things.
Yeah, these are actually advocates, not staff.
Okay, and
So
you
these
know,
are good
being
thoughts.
inside the prison and looking, I can tell you that much of our food and our equipment,
Yeah.
furniture, chairs, is operated by correctional industries, and these are incarcerated individuals working this. So there has been a lot of screening out. There was a time where frozen foods were being delivered. Did they have time to thaw? Generally, yes. Was there an occasional, misfire? I've heard. And I do. I get emails directly from family, and many of those, I get so many that some thanking me, some criticizing work. We follow up on those emails, and we send them out. I send them out, and often am paying attention to what those are saying. And, we've had some of that, frozen food and.
My sense is generally with COVID that if there was sort of a top line complaint or criticism, and again, I think people understand it's difficult to manage this in the prison environment, but that the incarcerated individuals have been, in order to try to keep the numbers down, and at least in some cases feel like they've had to sort of suffer limitations that were really unfair, either being, losing a lot of privileges, being in there. I mean, it's some of these folks are saying at Stafford, people are in the segregation area during this time. I don't know if that's true, but that this has obviously taken a toll. And as you said, 800 some days in.
840 some. It has taken its toll on everybody. The staff, the families, the workers that come in, the volunteers, University Behind Bars, everything stopped. And incarcerated individuals have really stepped up to protect themselves, to be vaccinated. We're hovering at about 60%. Wish it was a little higher, more in line with the community. Work releases are at 66%, I believe. So people are doing what they can. It's good to see folks getting out. The sun is shining. Folks are getting outside. Incarcerated individuals, they want to be outside. Families need to visit. We've tried to adapt, but I think we've adapted as well as any of the agencies have with visiting and programming, and it's challenging.
Let's use the balance of our time to talk about, if you're not in crisis, or while you're in crisis, the things you'd like to do to sort of shift this work and this agency and to rethink how we do corrections. And maybe to start the conversation, I was reading the most recent past corrections ombuds in her 2021 report, and she's now moved on, talked about things that she really wants the DOC to do. And I'll just give you a couple of examples. DOC should continue working towards creating a rehabilitative environment that reduces trauma for incarcerated persons, including de-escalation trainings, anti-racist trainings, and firm limits on the use of solitary confinement. And by the way, there's entire movements here to end solitary confinement completely. You've already reduced or eliminated it as a form of discipline in your agency. Create policies, procedures, and practices that respond to the needs of people engaging in self-harm. Increase access to mental health services. Provide appropriate and necessary treatments to individuals' medical needs. I think that the one thing that Joanna Carnes said that she was most concerned about is that it was access to health care, and wanting the DOC to really think of itself as kind of like a hospital. You walk in, you're going to get care, and you're going to come out hopefully healthier than when you arrived. So that's one sort of framing, is the corrections ombuds saying, I'm seeing some good signs, but she'd like to see this shift happen.
Yeah.
Is this a shift that you've also embraced? Is this where you're trying to go?
Absolutely, Austin. Joanna Carnes, the former correctional ombuds, is right on in all those things. And those are things Governor Inslee and I spoke of prior to my leaving DSHS and coming to the Department of Corrections. So, you know, let's unpack that a little bit. Top of mind for me is the healthcare reform.
And you guys have been under scrutiny for that. There have been cancer
absolutely.
deaths for untreated cancer. There have been lawsuits. There's been turnover with your top-level medical staff.
Yeah, I do. I have a new chief medical officer, which I'm very grateful for in terms of her stepping up and taking this job, Marianne Curl, formerly from the penitentiary. Very client-centered, very good practitioner, good administrator. I have a new assistant secretary for health services. I do. What I will say about the healthcare delivery model, well, I want to back up and say, you know, in spite of COVID, we have been moving forward on the very initiatives that you just cited from the correctional ombuds. Again, very much in line with what Governor Inslee is hoping for in the leadership of the Department of Corrections. And the DOC healthcare model, is not as effective as it could be. And we're trying to move from a treatment on demand where you go in, you've got a sore throat, and you go in. Yeah. And then we treat your sore throat, and then we'll see you the next time you need something. Yeah. We're trying to move to a new model called a medical home model. And this is not uncommon. This is where you're assigned a primary care physician, and you are on that physician and that team's caseload. And yes, we have a lot of movement across prisons, but with that model, we transfer. And the legislature has made initial investments. I didn't get everything I wanted with regard to major healthcare improvements this go around, but I think given the workforce shortage, I got enough to keep us busy, to get us moving. When I got to DOC, I used 40 vacant correctional positions to immediately start a patient medical home model for people with cancer. So we have seen good things. You know, cancer is really about, there's three aspects. There's prevention, so that's your yearly tests, your colonoscopies, your mammograms, you know, various studies and various tests. And you know, then it's diagnosis. Yeah. And to do that, you have to get specialty care. You have to go off-site. COVID has put some challenges in that, but we have made huge progress in the number of days beyond when we want you to see a specialty care provider to rule in or rule out cancer. And then there's the treatment of cancer. You know, so in spite of it being COVID, in spite of us being lower on staff than we'd like to be, we are making those off-site appointments. We've beefed up our quality assurance. So that's a very big deal. Trauma-informed care, training, you know, very similar to what we do in the mental health world, which is focus on this aspect of a person, just assume that they've had a lot of trauma, and that builds up, and it's how they view the world. And so getting at that is critical to successful reentry, successful living. A lot of incarcerated individuals will get out. Some won't.
Most will.
Most will.
Yeah. How do you, though, address the pushback that no doubt is happening among, you know, some will say, look, you just talked about the Norway model, that the going to court is the punishment part. There's going to be a lot of people who say, no, actually, that's assigning the punishment, and the punishment, you serve that in prison. Right. And this all sounds like we're getting a little too touchy-feely, spend a lot of money on, I mean, obviously people need to be treated for cancer, but is there do you hear pushback to this idea? And if you do, how do you respond to it?
Absolutely, we hear that pushback. This country is in a fight When it comes to corrections, you have those individuals who punish, and victims.
Yeah, victims.
I mean, terrible in the wake. And then on this side, redemption opportunities. It is a balance. We will do what we can while we have those individuals. And I have a constitutional requirement. People are in our custody and our care. There are constitutional requirements. I don't get into, I deal with those two sides of the story, but isn't that the public process, to have both those things going on, and somewhere in the middle we move forward, and
But for instance, some may say you've hired an executive or a new position. This is Christopher Polis, who came over from the State Reentry Council to be the Director of Person-Centered Services at the Department of Corrections. He is himself a formerly incarcerated person, so brings that perspective. He's looking at all policies and practices through the view of a person with that experience. What's the argument for a position like that? And again, some might say, wow, are we gonna, what is this a bridge or a step too far?
I don't think it's a step too far. I think that coming from DSHS, people wonder about me. Am I the leader that is taking us too far in one direction? Austin, I am trying to follow the science of reentry. These people that are in our care and custody, and a heavy emphasis on custody, they are removed from their families. They will have battles. They come into prison many times having been abused, living in poverty, not of the best health. And you have to recognize that. And you have to recognize that they're going to get out of prison. And the focus is on public safety. I am very much a public safety individual. Yes, I'm a nurse. That is just the humanity of the work, humans taking care of humans. But we are, it is a double-edged sword, because if you do not do things to address those key issues, what you have done is you have contributed to the decline of public safety. Crime is up all across the country. People need to be held in check, and prisons are very much that. And you can do that in a respectful, professional manner. I think if there is a criticism of me, it is that. It is a concern. The addition of Chris Poulos, I'm having him on my executive management team, having been a person with lived experience, incarcerated, he is helping inform our training of correctional officers. He is looking at the whole concept of dynamic safety, which is prisons can be dangerous places. We have some very violent individuals. We have a lot of individuals in prison who are also not violent. So there's a realm, a bell curve of individuals. Chris is informing how our curriculum should work to hold individuals accountable, but be safe in doing so. And I think he is talking with incarcerated individuals. He's talking with staff. He's very well received.
Yeah, and I just want to be clear, I'm not criticizing Chris himself. I've interviewed him several times, and
yes,
it's the question of the position, right? The concept, yes, exactly. The concept of having this position and sort of building things around the perspective of the incarcerated individual.
What I intended to do was not intentionally go out and go, a person with lived experience, I am grateful that I think a person with lived experience is important in the design of policy and addressing stigma and mental illness, poverty, and making sure we are in check in how we do things. So I'm grateful for the position. He is well received. He is a very smart individual.
Yeah, an attorney by training, and quite a tremendous personal story himself. We've previously had Jeannie Darnielle, the former state senator, on, who's also now the assistant secretary of your newly created Women's Prison Division. One of the things I know that you're constantly struggling with, and the number that every Secretary of Corrections wants to bring down, but it's vexing, is the recidivism number, which sort of seems to hover at about a third. Right. So 1 in 3 coming back, I think, within 5 years or so.
3 to 5 years.
3 to 5 years. What's the hope that you can be the Secretary of Corrections that gets that number down?
That's a great question. We've been hovering at recidivism. The whole country has been. Those numbers will be skewed now with the courts. I mean, COVID impacted the courts as well, right? So that aside, we think about that a lot. So. I think women are different than men, and so that's the whole Jeannie Darnielle situation. I'm excited to have her leading that helm. Recidivism, Native Americans recidivate at about 45%. I'm speaking today to the Bureau of Justice opening remarks for Native American reentry. So. We've got a problem here, and how can we move the needle on that? I've been talking a lot with Jan at the State Technical Board of Community Colleges, State Board of Technical.
We just had her on the program too.
She and I have had multiple conversations about really impacting recidivism. You have to have a job. You have to have a place to live. And so how do you get to that? How do you, those social determinants of health, and all the health subcabinet group talks a lot about social determinants of health. Education is a big piece of that. Jan and I are trying really hard to standardize curriculum. She's working with her technical community colleges. We're in the middle of developing a new contract with them to really try to create successful pathways so that you have an option outside of crime.
Just a couple minutes left here. The graduated reentry program has been described as perhaps the most significant sentencing policy change, at least in modern times. The goal of reducing the prison population, allowing people to serve some of their end of their sentence on electronic home monitoring out in the community, potentially could have a long-term effect of 3,000 fewer inmates in prison. Electronic home monitoring, people do and have cut off the bracelets and committed crimes. How confident are you that this program is not going to jeopardize public safety?
Well, I mean, the devil's in the details of that program. A program takes resources, and it is so much more than just that electronic home monitoring, Austin. The whole re-entry process is being revamped and re-engineered. And so a lot of coaching and mentoring and advocacy for programs, case management, you're seeing. So when someone goes on graduated re-entry, there is a lot of care case management that goes along with that, with housing, with a job, frequent check-ins, coaching, mentoring, again, away from that sort of traditional, we're waiting in the wings to see if you mess up. We're helping you be successful. Frequent check-ins. So we're seeing that on the community corrections side, the I-Coach transition model, the graduated reentry. It's very early in the program. It is innovative, but Washington has always been innovative in its sentencing alternatives. And time will tell, but we have to pivot and tweak as we go. So it's a work in progress.
Under a minute left, so I don't have time to have you wax about this philosophically, but I know a group of advocates recently wrote you a letter saying, please end the policy of using solitary confinement, not just for disciplinary purposes. Just in 10 seconds, is that the direction you're trying to head, or is that just not realistic from your perspective?
It is the direction we are trying to head. It takes a lot. We've been doing it for 10 years, and we've gone from big numbers to very low numbers. To take it to the next level, we have to have alternatives. We have very violent individuals, we have vulnerable individuals, and until we address those issues, we have to be very careful.
Okay. Secretary of Corrections, Cheryl Strange, thanks for being here. Appreciate it. Good to talk with you. Thank you for watching Inside Olympia, and we'll see you again next week.